Alcohol consumption can have far-reaching effects on the human body, influencing various physiological processes. When consumed, alcohol is rapidly absorbed into the bloodstream, where it exerts its impact on multiple organs and systems. One of the primary concerns associated with alcohol consumption is its potential to disrupt the delicate balance of blood sugar levels, a critical factor for individuals managing conditions like diabetes or obesity. Alcohol is a source of empty calories, devoid of any significant nutritional value. It is metabolized by the liver, a process that can strain this vital organ and potentially lead to liver damage if alcohol is consumed excessively or over an extended period. Furthermore, alcohol can interfere with the body's ability to regulate blood sugar levels, leading to fluctuations that can be problematic, especially for those with pre-existing metabolic disorders or taking medications to manage their conditions. Beyond its impact on blood sugar regulation, alcohol can also contribute to dehydration, impaired judgment, and an increased risk of accidents or injuries. It is essential to understand the potential risks and interactions when combining alcohol with medications, particularly those designed to manage conditions like obesity or diabetes. What is Ozempic and how does it work? Ozempic, semaglutide, is a prescription medication approved for the treatment of type 2 diabetes and obesity. It belongs to a class of drugs known as glucagon-like peptide 1, GLP-1, receptor agonists, which mimic the effects of a naturally occurring hormone called GLP-1. GLP-1 plays a crucial role in regulating blood sugar levels by stimulating the release of insulin from the pancreas and inhibiting the production of glucagon, a hormone that raises blood sugar levels. Additionally, GLP-1 slows down the emptying of the stomach, promoting a feeling of fullness and reducing appetite. Ozempic works by binding to and activating the GLP-1 receptors in the body, mimicking the effects of the naturally occurring GLP-1 hormone. This action helps to lower blood sugar levels in individuals with type 2 diabetes and can also promote weight loss by suppressing appetite and increasing feelings of fullness. The medication is administered through once-weekly injections, typically into the abdomen, thigh, or upper arm. It is essential to follow the prescribed dosage and administration instructions provided by your healthcare provider to ensure the safe and effective use of Ozempic. Can you drink alcohol while taking Ozempic? The short answer is yes, you can drink alcohol while taking Ozempic, but it is crucial to exercise caution and moderation. Alcohol can interact with Ozempic and potentially increase the risk of certain side effects or complications. It is generally recommended to limit alcohol consumption while taking Ozempic. Excessive alcohol intake can counteract the beneficial effects of the medication and potentially lead to adverse consequences. Understanding the risks and side effects of combining Ozempic and alcohol while moderate alcohol consumption may be acceptable for some individuals taking Ozempic, it is essential to be aware of the potential risks and side effects associated with combining the two. Increased risk of low blood sugar, hypoglycemia. Alcohol can interfere with the body's ability to regulate blood sugar levels, potentially leading to hypoglycemia or low blood sugar. This risk is heightened when alcohol is consumed while taking Ozempic, as the medication already lowers blood sugar levels. Nausea and vomiting. Both Ozempic and alcohol can cause nausea and vomiting as side effects. Combining the two may increase the likelihood and severity of these gastrointestinal symptoms. Dehydration. Alcohol is a diuretic, meaning it can promote fluid loss and dehydration. Ozempic can also cause dehydration as a side effect. Combining the two can exacerbate dehydration, which can be particularly problematic for individuals with diabetes or those prone to dehydration. Impaired judgment and decision-making. Alcohol can impair judgment and decision-making abilities, which may lead to poor dietary choices or a lack of adherence to medication regimens. Interactions with other medications. If you are taking additional medications alongside Ozempic, alcohol may interact with those drugs, potentially altering their effectiveness or increasing the risk of side effects. It is crucial to discuss your alcohol consumption with your healthcare provider and carefully consider the potential risks and benefits before combining Ozempic and alcohol. How does alcohol affect blood sugar levels while on Ozempic? Alcohol can have a complex and unpredictable effect on blood sugar levels, particularly for individuals taking medications like Ozempic. Initially, alcohol consumption can cause a temporary spike in blood sugar levels. This is because the liver prioritizes the metabolism of alcohol over other substances, including glucose, leading to a temporary buildup of glucose in the bloodstream. However, as the liver continues to metabolize alcohol, it can eventually lead to a drop in blood sugar levels, potentially causing hypoglycemia or low blood sugar. This effect is more pronounced in individuals taking medications like Ozempic, which already lower blood sugar levels. The impact of alcohol on blood sugar levels can vary depending on several factors, including the amount of alcohol consumed, the type of alcoholic beverage, e.g., beer, wine, spirits, the presence of food in the stomach, individual metabolic rates, and sensitivity to alcohol. It is essential to monitor blood sugar levels closely when consuming alcohol while taking Ozempic. Checking blood sugar levels before, during, and after drinking alcohol can help identify any potential fluctuations and guide appropriate actions, such as adjusting medication doses or consuming additional carbohydrates if needed. Ozempic and alcohol tolerance. Alcohol tolerance refers to the body's ability to metabolize and handle the effects of alcohol consumption. Individuals taking Ozempic may experience changes in their alcohol tolerance, which can have implications for responsible drinking. Some individuals report a lower tolerance for alcohol while taking Ozempic, meaning they may experience the effects of alcohol more quickly or intensely. This could be due to the medication's impact on appetite, metabolism, and gastrointestinal function. On the other hand, others may experience an increased tolerance for alcohol, potentially leading to overconsumption and heightened risks of alcohol-related side effects or complications. It is essential to be mindful of your individual response to alcohol while taking Ozempic and adjust your consumption accordingly. If you notice changes in your alcohol tolerance, it may be necessary to reevaluate your drinking habits and consult with your healthcare provider for guidance. Managing hangovers. While on Ozempic, hangovers are a common experience after excessive alcohol consumption, and they can be particularly challenging for individuals taking Ozempic. The combination of Ozempic's side effects, such as nausea, vomiting, and dehydration, with the symptoms of a hangover can exacerbate discomfort and potentially lead to more severe complications. To manage hangovers while on Ozempic, consider the following tips. Stay hydrated. Drink plenty of water or electrolyte-rich fluids before, during, and after consuming alcohol to combat dehydration. Consume nutritious foods. Eat a balanced meal before drinking alcohol and replenish your body with nutrient-dense foods the following day to aid in recovery. Rest and recover. Allow your body ample time to rest and recover from the effects of alcohol and Ozempic. Consult your healthcare provider. If you experience severe or prolonged hangover symptoms, seek medical advice from your healthcare provider, as they may need to adjust your Ozempic dosage or provide additional guidance. Remember, the best way to avoid a hangover is to practice moderation and responsible drinking habits while taking Ozempic. Tips for responsible alcohol consumption while on Ozempic. If you choose to consume alcohol while taking Ozempic, it is essential to do so responsibly and with caution. Here are some tips to help you navigate alcohol consumption while on this medication. Consult your healthcare provider. Discuss your alcohol consumption with your healthcare provider and seek their guidance on safe and responsible drinking practices while taking Ozempic. Limit your intake. Moderate alcohol consumption is generally considered safer than excessive drinking while on Ozempic. Aim for no more than 1 or 2 standard drinks per day, and avoid binge drinking. Monitor your blood sugar levels. Check your blood sugar levels regularly before, during, and after consuming alcohol. Be prepared to adjust your medication dosage or intake of carbohydrates as needed to maintain stable blood sugar levels. Stay hydrated. Drink plenty of water or non-alcoholic beverages to combat dehydration, which can be exacerbated by both Ozempic and alcohol consumption. Eat a balanced meal. Consume a nutritious meal before drinking alcohol to help slow the absorption of alcohol and mitigate potential blood sugar fluctuations. Avoid risky situations. Alcohol can impair judgment and decision-making abilities, so it is essential to avoid activities that require coordination or concentration, such as driving or operating heavy machinery. Be mindful of interactions. If you are taking other medications in addition to Ozempic, be aware of potential interactions with alcohol and consult your healthcare provider for guidance. Remember, responsible alcohol consumption while taking Ozempic requires careful monitoring, moderation, and open communication with your healthcare provider. Does drinking alcohol affect weight loss on Ozempic? One of the primary uses of Ozempic is to promote weight loss in individuals with obesity or excess weight. However, alcohol consumption can potentially interfere with the weight loss goals associated with taking this medication. Alcohol is a source of empty calories, meaning it provides energy, calories, without any significant nutritional value. Consuming excessive amounts of alcohol can contribute to an overall increase in calorie intake, which can hinder weight loss efforts. Additionally, alcohol can stimulate appetite and cravings for unhealthy foods, leading to poor dietary choices and overconsumption of calories. While moderate alcohol consumption may not significantly impact weight loss efforts for some individuals, excessive or frequent drinking can counteract the appetite-suppressing effects of Ozempic and potentially stall or reverse weight loss progress. It is essential to maintain a balanced and healthy diet, engage in regular physical activity, and practice moderation when consuming alcohol while taking Ozempic for weight loss purposes. Conclusion: making informed decisions about alcohol while on Ozempic. Navigating the relationship between Ozempic and alcohol consumption requires careful consideration and informed decision-making. While moderate alcohol consumption may be acceptable for some individuals taking Ozempic, it is crucial to be aware of the potential risks, side effects, and interactions. By understanding the impact of alcohol on blood sugar levels, alcohol tolerance, and weight loss goals, you can make informed choices about responsible drinking practices while taking this medication. Remember, open communication with your healthcare provider is essential. Discuss your alcohol consumption habits and any concerns you may have, as they can provide personalized guidance and recommendations based on your individual circumstances. If you are taking Ozempic and have questions or concerns about alcohol consumption, don't hesitate to consult with your healthcare provider or seek professional advice. Our team of experts is here to support you in making informed decisions and achieving your health goals safely and effectively. Contact us today to schedule a consultation and take the first step towards a healthier lifestyle. By prioritizing moderation, monitoring your blood sugar levels, and maintaining a balanced lifestyle, you can navigate the potential risks and interactions of combining Ozempic and alcohol responsibly.